Great. Welcome, everyone. We just have a couple people joining, but we'll go ahead and get started with our session today. Welcome to our webinar entitled Canadian Engagement in Global Trachoma Elimination Strategies. My name is Alison Krentel, and I'm an associate professor at the University of Ottawa's School of Epidemiology and Public Health, and I'm the current chair of the Canadian Network for Neglected Tropical Diseases, or NTDs. We are pleased to host this webinar today in partnership with Orbis Canada. And in Canada, we begin official meetings such as this with an Indigenous affirmation. So I'm speaking to you today from Ottawa, so my remarks reflect that my current location. We pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. And we acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So although our remarks today are in English, si vous parlez en français, vous êtes le bienvenu d'écrire des questions en français. Please feel free to put any questions in French in the chat box. So today we have a great panel of engaging experts on trachoma with us from the World Health Organization, the Pan American Health Organization, and Orbis Ethiopia. Each will share their unique experiences with trachoma elimination strategies around the world. And we've all had many Zoom meetings over the last few years, but please do remember to keep your microphone on mute unless you're speaking. And please do feel free to write any questions you may have in the chat for our Q&A session at the end. We will begin today's webinar with opening remarks from the Honorable Senator Stan Kutcher of Nova Scotia, who has been a champion for greater Canadian engagement in the fight against neglected tropical diseases and trachoma. Following Senator Kutcher, we will invite Kristen Chenier, the Director for Policy, Infectious Diseases, and Pandemic Preparedness at Global Affairs Canada's Health and Nutrition Bureau, to say a few opening remarks. So, Senator Kutcher, over to you.
Thank you very much, Dr. Krentel, and thank you everyone for being here. It's a pleasure and it's a privilege for me to participate with you today. I'm a physician, but I'm no expert in this area. I had worked for decades in sub-Saharan Africa and had seen firsthand the impact of neglected tropical diseases there. My area was in mental health. But it was Dr. Krentel who really piqued my interest in this whole area and got me interested in talking with the NTD network and finding out what was happening. And as I got more and more interested, I looked into what could possibly happen that Canada might be playing a part in. And trachoma really came out because it was an issue that had been tremendous progress made in the region of the Americas, that it needed a nudge and a push to get over the goal line. Canada has a long-standing relationship with PAHO. And in fact, I had the privilege of working at PAHO for 6 months a couple of decades ago. So it seemed like a really, really good fit, a good return on investment, consistent with Canada's global interventions, focus on needs of women and children. And then Dr. Solomon came to the fore and helped me better understand this whole area. And in conjunction with two of my colleagues, Senator Peter Beam and Senator Mohammed Ravalia, we had numerous meetings with then Minister Harjit Sajjan and people in Global Affairs Canada. And it took a little bit of effort. It took a lot of work in GAC, and I want to thank them for the tremendous work that they did, and they stepped up to the plate on this one. And here we are. So we are very, very pleased that Canada has made a commitment to address trachoma in the region of the Americas. We realize that this is only part of what needs to be done globally, and I'm looking forward to hearing the challenges in Ethiopia today. But I want to note that we are moving in the right direction, but we're not where we need to be. And Dr. Krentel and I talked briefly about this yesterday. I said it's like running a 400-meter race. We're at the 350-meter mark, but that's not the 400-meter mark. We have to keep pushing. And I used to run the 400 meters back in the day when I actually could run. And I know that the last 50 meters are really, really tough. You know, my track coach had a saying: when the going gets tough, the tough get going. And here we are at the 350-meter mark, and we have work to do. So thank you, everyone, for being here. Thank you for the work that you are doing. You're doing incredible work, and I'm just very proud to be able to say that I support the work that you are doing, and I'm very proud of Canada for stepping up and helping us get through that last 50 meters. So I'm going to sign off on the video. I will stay online and listen and learn. So thank you again for inviting me, and I'm looking forward to hearing from all of you about what else needs to be done in that last 50 meters. Thanks so much.
Thank you, Senator Kutcher, for your remarks and for your engagement and support on this issue. It's been a pleasure to work with you. And now I'd like to invite Kristen Chenier to say a few words on behalf of Global Affairs Canada. Kristen.
Yeah, good morning, colleagues. Bonjour, chers collègues. It's a real pleasure to join you today at this webinar and be part of the last 50 meters. And we're just 1 week away from World Neglected Tropical Diseases Day on January 30th. So nice timing as well on that. Certainly from our side, we really appreciate the focus on eliminating trachoma in particular. Of course, the leading infectious cause of blindness and visual impairment globally. And I too would like to recognize and appreciate the leadership and hard work of our Canadian and international partners in advancing the elimination of NTDs. Canada has been a long-term supporter of the elimination of NTDs, and you all know, and you worked very hard to have Canada sign on to the Kigali Declaration, which was an important call to action for implementing countries, donors, the private sector, civil society, to commit the resources necessary to drive down the burden of these diseases. And that high-level commitment was really encouraging, and we've been really pleased to match that policy commitment with to be able to provide some concrete support to partners. And of course, as Senator Kutcher mentioned, this includes the 15 million grant to PAHO to eliminate trachoma in 10 countries in the Americas over the next 5 years. And ultimately, we hope that the initiative should save at least 5.6 million people at risk of visual impairment or blindness, and support another 4.3 million people from contracting trachoma and treating it by implementing sustainable interventions within public healthcare systems. I'd like to acknowledge and appreciate the efforts made in particular by the Canadian Network for Neglected Tropical Diseases to maintain high-level attention on the need to end NTDs and continue to engage with global affairs and keeping our attention and focused on eliminating NTDs. And really look forward to the webinar and hearing what's happening in this space. And a special shout out, of course, to Senator Kutcher and his colleagues, who have been really first-class advocates for NTDs and for trachoma in particular. And we're really pleased that we've been able to work together to be able to make something happen in this space. So thanks so much. Look forward to the discussion.
Thanks so much, Kristen, for your remarks, and thanks for being here. We're delighted to have you here as part of the webinar today. So without further ado, we will introduce our first speaker, Dr. Anthony Solomon. Dr. Solomon trained as an infectious disease physician and epidemiologist, and is currently the chief scientist and medical officer for neglected tropical diseases at the Global NTD program at the World Health Organization. So I will pass over to who we call Saul in the NTD community to lead us with our first presentation today.
Thank you very much, Alison. It's very kind of you. I'm extremely grateful for the opportunity to contribute to this, and even more grateful to Senator Kutcher and his colleagues in the Senate and everyone at Global Affairs Canada for the commitment that they've shown to trachoma elimination. Hopefully you can see those slides now.
Yes, there's visual. Thank you.
Marvelous. Thank you very much. So I'll start with a couple of photographs, a little bit small to insulate you from the full horror of trachoma, but I know that there are some people on the call who potentially know the appearance of the disease a little bit less well than others. The top photo there is a normal conjunctiva. That's the undersurface of the eyelid that's been flipped over to show you the side that normally rests against the eye. It's clear and smooth, and you can see the blood vessels. In the second photograph down, you have a picture of active trachoma with those little white dots, like little pustules essentially under the surface of the lining membrane, the conjunctiva. In the third photograph down, you can see the scarring that results from that inflammation that's shown in the second photograph. And then the scarring contracts and causes the eyelashes to turn inwards and rub on the surface of the eye. Historically, it's been believed that that was a linear process, but in fact, we now understand that it's much more complicated than that. We have a cyclical process of repeated reinfection driving that inflammatory appearance that is required to generate any scar. And in fact, the models that have been developed suggest that 150 infections are required in a person's life for the development of those long-term scarring complications and for the potential for blindness and vision loss to occur. It's a complicated diagram, but that's really the essential point that I wanted to make. We think 150 infections are needed. So the kids who are going to go blind from trachoma in the future are kids that are getting infected repeatedly, week on week. It's perhaps a little bit more instructive to visualize how that pathogenetic pathway operates at community level like this, because it allows us to get a sense of the time course and the impact on people and populations. So infection is spread from person to person, particularly child to child and child to mother to child. And each time someone is infected, they develop an episode of active trachoma with repeated infections over many years. We get scarring of the eyelid, trichiasis in mid to old age, and corneal opacity and blindness. And the steepness of that slope leading to blindness is a representation of how intensely this pathogen is transmitted in the community. Because we need 150 infections to go blind, it suggests that all we need to do is reduce the transmission intensity to the point at which no one crosses that threshold number of infection episodes. If we fail to achieve that, then people do go blind. This is a Tanzanian man who has trichiasis, the sort of end stage of trachoma, who has gone blind from the disease. You can tell that it dramatically affects his life because he's a bloke who doesn't have many things, and 3 of the things that he has are shown in the photograph, and they're there to help him with his trachoma. So he's got a strip of cloth tied around his eyebrows to stop his eyelashes, his eyelids from spasming shut in bright sunlight. He's got a pair of forceps around his neck on a piece of string so he can pull out his eyelashes when they become too painful. And he's got a stick leaning against his chest to help him navigate around the village with a person who will help him lead the way, typically a junior member of the family who's therefore unable to go to school. We can interrupt that process by giving surgery to people who have trichiasis and prevent further vision loss, by giving antibiotics to the community to reduce the prevalence of infection, and by reducing the spread of infection from person to person by providing clean water and sanitation and encouraging people to keep their faces clean. Those things will reduce transmission. And those 4 interventions, surgery, antibiotics, clean faces, and environmental improvement, make the acronym SAFE. The S is first in SAFE, not just because it makes a good acronym, because it's the most urgent intervention to stop people going blind today. We have a real focus in the global program on quality in every part of what is done, in every trichiasis operation, in every intervention to distribute antibiotics to populations, at every health education interaction, in every effort to improve access to water and sanitation, and in every survey. And continuing to insist on excellence is critical. It's part of our contract to each other and to the populations that we serve. So, whilst keeping a focus on quality, safe strategy interventions have also been massively scaled up to become very large scale. This graph shows the number of people given antibiotics for trachoma every year on the y-axis and the years along the x-axis. And thanks to the generosity of Pfizer and the hard work of the team at the International Trachoma Initiative, the number of people who have been given antibiotics for trachoma each year grew at a quite considerable pace until 2019. We then had a rather marked reduction due to the effects of the COVID-19 pandemic and some issues with supply. But we're certainly getting to the point where impact is being made. And this graph shows that impact. We have the number of people living in districts where the prevalence of active trachoma, those white dots under the eyelid, is more than 5% in children. That's on the y-axis, and again, year on the x-axis with some discontinuity. In 2002, 1.5 billion people lived in those kind of districts with active trachoma. We're now down to 116 million as of April last year. It's a 92% increase. We can illustrate progress in a slightly more granular way by looking at the prevalence of the active trachoma sign TF in 1 to 9-year-olds at district level across West Africa, for example, from Senegal and the Gambia in the far west to Chad, Cameroon, and CAR in the east. Each district shown here represents a population of 100,000 to 250,000 residents, and the colour indicates the prevalence at baseline, regardless of the year at which the baseline was determined. Districts coloured green are those in which the TF prevalence is less than 5%. That's the threshold defined as elimination as a public health problem. And then yellow, orange, red, and burgundy are progressively more children with active trachoma. The burgundy colour indicates that more than half the children had active trachoma at the baseline survey. So that's baseline, and that is on the bottom right of the screen in 2023. And you can see what progress has been made in a very easy comparison. Similarly, this is the number of people who have been, who need an operation to correct, this is the number of people who've been given operations for trichiasis year by year. This is far more susceptible to inputs, to the amount of money that's provided and the political will to make things happen. We have substantial numbers of people being operated on every year. And similarly, we've seen a reduction in the global prevalence of people needing TT surgery from 7.6 million people in 2002 to 1.5 million in April of last year. That's an 80% reduction. And as a consequence of all of that work, we're now seeing a large number of countries getting to a position where they can be validated as having eliminated trachoma as a public health problem. The first was Morocco, excuse me, back in November 2016. And the most recent was Iraq in July last year. Trachoma is, of course, part of the group of 21 diseases and disease groups referred to as the neglected tropical diseases, or NTDs. And the Canadian Network for NTDs is doing a fantastic job of keeping the flame alive in Canada. And thank you to Alison and the team for all that you do. In 2020, WHO published this roadmap document following a 2-year period of consultation with the NTD community globally. And that roadmap was endorsed by the World Health Assembly in 2020. And as well as setting a number of overarching and cross-cutting goals for NTDs overall, it sets 2030 as the target date for global elimination of trachoma as a public health problem. That's not far away, as you know. The three of us speaking today, and probably quite a few people tuning in to listen, are doing everything that is humanly possible to try and meet that target. It's closer because of Canadian support. So thank you very much to each of you for everything that you're all engaged in. Thanks, Alison. I'll stop there.
Thank you so much, Saul, for your remarks and for giving us a great introduction to trachoma and where we are globally, and also for highlighting those 2 countries that have just reached elimination. So it is possible. It is possible to cross the 400-meter mark, the end line. And so thank you for those remarks. I'd like to move on to our next speaker, Dr. Alemayehu Sisay, who is an ophthalmologist and public health specialist. He is the Orbis Ethiopia country director and has worked with Orbis International since 2003. So we look forward to hearing from you today, and hand over the microphone to Dr. Sisay. And your slides are visible, and when you're ready, go ahead. You are on mute though, so please, there we go. Great.
Sorry, I would like to thank the Canadian Network for Neglected Tropical Diseases and Orbis Canada for having me for this important global event. My point here is to share you the Ethiopia Trachoma Elimination effort through the collaborative work between the Ministry of Health and the implementing partners. And I would like to share with you a little bit of overview or background about the trachoma situation in Ethiopia. As you know, globally, 132 million people live in trachoma endemic areas, and Ethiopia accounts for 52% of the global burden, with 691 districts sorry. 691 districts endemic to trachoma, and close to 70 million people at risk of infection. As you all know, women are more likely to get blind due to the frequent contact with infected children as primary caregivers, as Saul tried to explain a part of that. And millions of underprivileged and impoverished children and women are vulnerable to blindness to these preventable diseases. It is estimated now that 178,125 TT cases need urgent intervention to address the immense pain and suffering, stigma, and possible blindness. A 20-minute tracheostomy surgery can be transformative in unshackling individuals from the relentless agony and imminent threat of irreversible blindness. As the trachoma community or the NTD community knows very well, trachoma elimination contributes to the achievement of the Sustainable Development Goal and vice versa. To give you a little bit of the burden of trachoma in Ethiopia, I have to go back to 2014 and 15, where the first ever trachoma mapping was conducted across endemic districts. Ethiopia was one of the beneficiaries. And according to that robust trachoma mapping project, 952 districts were included in the mapping process, and 798 districts were enrolled into the National Trachoma Control Program following the mapping. As you can see on the color, Most of the districts here are colored red, pink, and yellow, and few in green. And this clearly indicates that trachoma requires a public health intervention at that time. And very interesting to note here is 352 districts have a TF prevalence of greater than 30%, which is called hyperendemic. And close to 71 million people live in trachoma endemic districts as per that finding. And this indicates the TT prevalence back then. Again, as you can see the color here, most of the districts require public health intervention, particularly those that are color-coded red, pink, and yellow. Those few districts with green require no more intervention at the beginning of the study. The progress to date, I think Ethiopia has been implementing the WHO endorsed safe strategy for many years and has made a remarkable achievement toward the trachoma elimination. The TF prevalence reduced from 28.33% at baseline to 12.81% in 2020. This is a national level crude estimate. Otherwise, all the data are district-based. And great progress is being made toward this reduction of the national prevalence of TT from 4% in 2015 to 0.73% in 2022. This is a significant reduction in terms of TT elimination. In mid-2023, a total of 295 waradas achieved a TF of less than 5%, and 186 waradas achieved TT less than 0.2% among population age greater than 15 years. I would like to emphasize here that though these successes have demonstrated substantial progress, the WHO strategy must be continuously be implemented for absolute transformation to occur and to achieve trachoma elimination as a public health problem. So the Ethiopian national program, as so indicated, tried to implement the whole safe package altogether. One without the other may hinder the progress toward this elimination. Surgery for those requiring immediate surgical intervention, antibiotic for districts having a TF of less than 5%. The round of MD may range from 3 to more than 7, and facial cleanliness and environmental sanitation. I think Saul clearly depicted the picture, the diagram in his presentation, that these are the critical intervention tools to stop the transmission and limit the number of infection and subsequent complication of the blinding form of trachoma. Here, as you can see, over the years, at baseline in 2022, the TF prevalence at regional and national level has drastically reduced. Starting from Afar region to Tigray region, if you see the baseline TF, it was greater than 30%. And the national crude prevalence had been 28.33% back then. And now it is 12.81%. This is a 55% reduction from the baseline. And as you can see, the annual MD treatment, by the way, MD started in Ethiopia in 2003 through a collaboration between the Carter Center, Orbis, BBD Trust, and ITI International. So through the collaborative effort, we started MD in 3 districts, one in Amhara, one in Oromia, and one in southern Ethiopia. And since then, as you can see in the diagram, the number of MD administered through support from Pfizer and others has been increasing drastically. And this correlates also with Saul's PowerPoint. Towards the end of 2020, 2021, and 2022, there is a slight reduction in the number of MD distributed, partly because of the COVID pandemic and partly because of the global Vitromax production challenges. This is a very interesting color indicating the change over time. The right side with a lot of yellow, red, and pink color indicates the need for the safe package implementation. And on the other side, you see the number of green districts that have increased drastically over the years. These are districts that achieve a TF of less than 5% through the safe implementation. This clearly indicates a progress on the right direction. On the TT surgical aspect, exactly also this relates to Sol presentation on the TT performance globally. Probably a significant proportion has been from Ethiopia that may explain the similarity between Sol's presentation and mine. And as you can see again, the number of TT surgery performed over the years has increased. And particularly in 2016 and 17, where the Ministry of Health has taken a drastic national TT clearance initiative that increased the number of TT surgeries performed. And in 2020 and 2021, because of the COVID and other factors, there is a slight reduction in the number of TT surgeries performed, but I think we are catching up with that. Currently, there are 178,000 people requiring TT surgery, as I have explained. I think with the limited time I have, I don't want to go into detail on the WASH part, but I would like to emphasize that unless a proper WASH coordination, NTD WASH coordination is in place in the program, unless both behavioral change and infrastructure development is implemented alongside surgery and antibiotic, the transmission between children, infected children and mothers and within the community itself will not be achieved. So I would like to emphasize that WASH intervention is a critical component to ensure long-term sustainable trachoma elimination through transmission prevention. I think the Ministry of Health and the partners, the WASH partner, trachoma partners, we have been implementing community-based, school-based, facility-based interventions and also behavioral change campaigns during MDA. And there are a lot of activities being done through the FND toolkits and others. This is a very simple, collaborative school WASH initiative. It's not a significant significant investment, but through collaboration between school community, parents, development partners, ministerial organizations, we were able to demonstrate that this can be done in school where we can provide WASH interventions. These are small-scale community-based interventions carried out by local communities in an effort to address the WASH part of the SAFE strategy. I would like to emphasize on the consortium effort to eliminate TT in Ethiopia with a support from the Child Investment Fund Foundation and partnership between Orbis, the Carter Center, Fedolos, and Simprit under the leadership of the Ministry of Health. As you can see in this graph, the consortium has contributed over the years a significant proportion of the TT surgeries performed in Ethiopia. In 2022-2023, 86% of the TT surgery performed has been through this collaborative efforts through those organizations I have indicated. And as you can see, the total contribution has been 73%. And this also relates to the WHO TT surgery performance. A significant proportion, probably more than half of it, has been through this collaborative effort implemented in Ethiopia.
You have you need to wrap up, Dr. Sisay. Sorry,
okay.
you're out of time. Thank you.
This is to indicate the gender disparity. And the success factor here is leadership engagement, focused supportive supervision by the Ministry of Health, proactive donor engagement, leadership and political leader engagement, transition from implementing partner-led to regional health bureau-led programs, and surgeon-centered and surgeon-led implementation. I will not take up much of the challenge section here. The two most important things I would like to emphasize is that funding has to continue to ensure elimination is achieved by 2030. The national and regional collaboration has to continue, and we have to sustain the gain, addressing persistent and recurrent districts. These are a hindrance to ensure elimination is achieved timely. So this requires a creative, innovative approach to ensure trachoma is eliminated. And I would like to thank all the partners working in Ethiopia to ensure trachoma is eliminated. And with that, I will hand over to you. Thank you so much.
Thank you so much, and my apologies for interrupting. There's a lot of interesting material to be covered, and thank you so much for sharing with us what's going on in Ethiopia, and just highlighting the important burden in Ethiopia of trachoma and the incredible progress that has been made. So thank you so much for your remarks. We'll turn to our final speaker today, Dr. Sandra Talero, who is a Colombian national optometrist, physician, ophthalmologist, an oculoplastic surgeon who has a master's degree in public health from Johns Hopkins in the US. Dr. Talero is currently supporting the initiative to improve the health of communities, women, and children through the elimination of trachoma in the Americas, which PAHO is implementing with support from the Government of Canada. So welcome, Dr. Talero, and over to you.
Thank you for the introduction, and thank you for the invitation. My pleasure to be here. Can we share the presentation, please?
Claire, are you able to bring the presentation up? Here it comes right now. Okay, thank you.
Thank you so much. Good afternoon to everyone. This is a great opportunity to present the initiative, Improve Health of Communities, Women, and Children through the elimination of trachoma as a public health problem in the Americas. Next slide, please. This initiative aims to support the efforts to eliminate trachoma as a public health problem in the region over the next 5 years. And it's a reality, thanks for the partnership between the Pan American Health Organization and the Government of Canada. It's important to note that it's aligned with the Pan American Health Organization initiative for the elimination of more than 30 communicable diseases and related conditions by 2030. Here you can find this QR code if you want more information about this elimination initiative from PAHO. Next slide, please. The efforts to eliminate trachoma are directed to populations living in vulnerable conditions in trachoma endemic areas, as well as in areas where trachoma is suspected. Such as those areas are areas with insufficient access to clear water, basic sanitation, education, and health services, especially women, children, hard-to-reach populations, and indigenous populations. Next slide, please. Evidence shows that trachoma disproportionately affects women and children. And with this initiative, we are working on the generation of evidence on gender inequalities in health, strengthen information systems, and capacities of local health workers and women groups to provide integrated services. The use and adaptation of intercultural dialogues to trachoma will help to create spaces and, none less important, the development of inclusive communications. Next slide. This initiative includes two main components of on environmental sustainability and environmental aspects. The first one is to reduce the impact of the project activities in the environment through the management of waste and reduction of the carbon footprint. And second, increase actions on WASH, as was mentioned before, through the F and E components of the SAFE strategy. It's important to note here that a special consideration are being applied since the trachoma-affected communities are located mostly in remote rural areas. Next slide, please. Trachoma elimination is an opportunity to provide services to populations living in vulnerable conditions, and trachoma activities can be integrated with other actions of interest in public health, with services focused on the needs and the context in which people and communities live. And here is an example from Colombia, where trachoma actions are integrated into other actions of interest in public health, as vector control, visual health, and animal immunization in the Amazon region. Next slide. So 10 countries are participating in this initiative for the elimination of trachoma in the Americas, with more than 5 million people at risk of trachoma in endemic areas of the endemic countries. And participating countries belong to Central America, South America, and the Caribbean. Next slide, please. The participating countries in the region are divided in 3 groups: trachoma endemic countries, and this group Brazil, Colombia, Guatemala, and Peru, and trachoma suspected countries with populations living in vulnerable conditions and where trachoma could be a public health problem. And those are Bolivia, Ecuador, El Salvador, Haiti, and Venezuela. And Mexico, that is the only country in the region that reached elimination in 2017. Here is another QR code where you can find special information, and you can find which actions are being implemented in each of these countries and which are the objectives and goals for these countries at the end of this 5-year initiative. Next slide. And again, thank you for the invitation and the opportunity to share with you this information from our region.
Wonderful. Thank you so much, Sandra. And we look forward to hearing how the project progresses. I know it's just begun, so this is a great introduction, and we'll look forward to hearing how it progresses over the next 5 years. So we have a moment for some questions. So thank you to all of our speakers for sharing your remarks today. And we have a couple in the chat. So as I'll launch with one question, but if there's anything that comes up that you want to know more about, please do put it in the chat box and we'll try and get to all of them. So we'll start with you, Saul. You highlighted 2 countries where trachoma has just been eliminated, but there are other countries and regions where the disease has been eliminated. And we're just wondering, from your perspective, what have we learned from some of the successful strategies that we could maybe apply in those regions that are still working towards elimination?
Thanks, Alison. Yeah, I may have erroneously given the impression that only 2 countries have been validated so far. Iraq was the most recent and the 18th country, so we've got some runs on the board, so to speak, but there's plenty more to be done. There's a total of 67 countries that are currently or formally endemic, so there's still lots of work to do. In terms of what we learned, I could probably come up with a very long list, but 3 things perhaps. Firstly, trachoma country is hard country. They're difficult places to work. Some of the areas that Alemayehu and the team go to in Ethiopia are just tremendously difficult places to work. Similarly, remote Amazonian communities, they're not easy to access. The people are not necessarily wanting intervention or understanding it. So there's plenty of work to do. Second thing that we've learned, we can do it. We absolutely can do it. And then the third thing, some of the bits that are essential to achieving it are non-exclusive list, partnerships, good data, and a lot of humility, because we certainly don't have all the answers. We know what needs to be done, but there are always things that surprise you.
Yeah, thank you. And I think there was highlighted also in the comments about WASH and the importance of partnerships in WASH as well, and the value of that. So thank you. Just one before we go to our next panelists, could you comment on the antibiotic regime used in most of the regions, Saul, before I pass on to our next panelists?
Predominantly, the antibiotic used for mass drug administration is oral azithromycin, given in single dose, and it's donated by Pfizer through the International Trachoma Initiative for that purpose to trachoma elimination programs around the world. anyone who's unable to take his oral azithromycin, particularly the younger kids under 6 months of age, usually offered tetracycline eye ointment as an alternative, but it's much harder to use. It needs to be given for 6 weeks.
Great, thank you. And I hope that answers was one of the questions that came in on the chat. So Alemayehu, we'll come to you. You highlighted some of the challenges in Ethiopia, and we know that one of the challenges we face globally in our programs, in our neglected tropical disease programs, but also in trachoma, is the mobility of people, whether they're moving because of migration or because of conflict. And I wondered if you could just comment a little bit on how your program and Orbis has managed MDA given the high mobility in some of the regions of Ethiopia.
Thank you, Alison. I think internally displaced people, conflict communities, and also pastoral communities require special attention to address the need of their public health issues. I think understanding the complexity, the dynamism of those specific situations is very critical, and a tailored approach should be applied. There is no one-size-fits to all situations. So as a development partner, we are there to serve the public need. I think whether that is security, conflict, and other areas, that has to be made clear. So we have to work with anybody who have that common interest, number one. Number two, understanding pastoralist communities, where are they moving and why are they moving? The timing, the situation has to be understood. And we have to follow that healthcare system to address the need. And sometimes we have to work with the Ministry of Health because there are special strategies to address those concerns. And in IDPs, again, we have to understand the culture, the dynamism, the complexity, and the need. Do they need TT surgery there in the camp or MDA? So we have to have an evidence-based approach to address the need. So it has to be understood very well, the situation, and a customized approach should be followed. And there's also an ICTC working group to address this special population group. We have to follow that.
Thank you. And I think you've highlighted a really important partnership that we have in NTDs, and I'm a researcher, but we have partnerships with NGO partners and government partners, and just the importance of this community of people who work together and share evidence and share learnings and test different approaches. And that's one of the important elements, I think, of the community of NTD, people working in NTDs. So next question for Sandra, and this has just come in actually from Prof. Jerry Wema in Kenya. And she writes, I'm curious to know the basis on the identification of the second group of PAHO countries that are considered to be suspect. What are the plans to address this suspicion in the project?
Thank you. Well, there was a previous work from PAHO related with trachoma, because so many populations in the region share the same determinants, social determinants. So given that it was an exercise to prioritize communities over the region and give some indicators, some strengths to identify which of these countries could have populations with similar conditions of the ones that belong to the endemic countries. So with this exercise, PAHO identified some high priority countries to involve in surveillance actions to evaluate if trachoma could be a public health problem, and develop work consultancies in the region and with the experts to address this issue. And in these countries, we're going to conduct rapid assessments, trachoma rapid assessments, to know if in these areas with the very, very challenges and with the poor conditions in the country, we can find evidence of trachoma. And if the trachoma rapid assessments are positive, we need to conduct their surveys to be sure that we are addressing the issue. And if the surveys find that trachoma is a problem, implement the elimination strategy, that is the full implementation of the SAFE strategy.
Thanks, Sandra. And it sounds like there's a very thorough approach in the region to address that. A question from Kishore Wasson here in Canada. Is there a vaccine to prevent trachoma? And if so, is it available or accessible for countries and communities inflicted with the disease? And I'm looking at you, Saul, and thinking you may be the best one to address that question.
Happy to. There isn't at the moment. There's no commercial vaccine. There's no vaccine that's been demonstrated to be effective. It's possible that Kishore is thinking about the fact that there has been a first-in-human trial of a anti-chlamydial vaccine that's specifically been developed to try and prevent urogenital infection with chlamydia. The organism, the species of organism that causes urogenital chlamydia and trachoma is the same, but they're different serovars. So it is possible that a common mucosal immunity could be established with a single vaccine. It's something I'm very interested in pursuing. The group at NIH has been leading that work, and it's something that I think we could be trying to pursue. As yet, though, there is no vaccine that could be made available.
So stay tuned. So one of the important elements of the Canadian Overseas Development Assistance is the Feminine International Assistance Policy and the focus on women and girls. And we know that trachoma has a particular impact on women and children and young girls. And so I wondered, Sandra, if you could just speak briefly about in PAHO with the project that's being outlined. Are there specific ways that you're thinking the project will address the issues and the inequities around women and girls and how they may be disproportionately impacted by the disease?
Yes, thank you for the question. And especially for the endemic countries, we are trying to develop ways to train people in the communities, people that belongs to the health services to address this issue, because evidence has shown that women are disproportionately affected and children as well. So we need to be sure that the people that are going to the field and perform all the activities, they are aware of that and they are trying to implement actions to address that issue. And from the point of view of collecting information, we are trying to implement in the data collection all this disaggregated data that could give us information to act in a way that we can move forward and provide more equitable interventions. And the other thing is that we are working with non-endemic countries, trying to introduce during the trainings, for example, grading trainings and trainings in the field, this small module related with gender and diversity, ethnic diversity training for people that are going to the field. So these are some issues that need to be addressed because we recognize that even us from in the region, we are not aware of that and we don't have enough knowledge about gender and equity. So from the region, our regional unit is supporting actions in the 10 countries, and we have a specialist just for the project working on that issue and trying to involve all countries and the Ministry of Health with their specialists in gender and ethnic diversity to work with us and all learn from this project and from this initiative how to go to the communities and involve the communities from the beginning in the planning, in the implementation, and in the monitoring to work together to address this important issue.
So maybe it'll be a springboard for other for more awareness in this area. It sounds like, which is excellent. We'll go provide a last question here to Alemayehu. If you could comment about cross-border regions and how you've addressed this in Ethiopia. If you could make a comment on that, it came from one of our listeners.
Thank you so much, Alison, for the question. That's a very important question because in the last mile effort to ensure NTDs are eliminated, cross-border issue is critical. So in the East African and South African community, we have established a cross-border NTD community where we can learn and share experiences. And sometimes we do also cross-border, in the neighboring regions like Kenya and Ethiopia, South Sudan and Ethiopia, we do conduct joint MDA and some TD surgery programs. So it's not well established, but we have the intention and the engagement across the border area to ensure NTDs and particular trachoma is eliminated. Yeah.
Thank you. Yeah, it's one of the challenging, we've highlighted a lot of we're in the last mile in many of these countries, and these are the most difficult, provide the most difficult challenges for us. There are some questions that we're not going to get to, and I'm going to ask Camille, who's been recording these, to please note them, and we'll share them with our speakers, and we'll share responses with you also when we post the videos, so that you can get answers. Some of the questions are quite technical, and we want to make sure that you get answers to those questions. So I want to thank all of our speakers today. You've given us an excellent overview of trachoma and the public health importance of this disease. I'm hoping that all of us have come away with some new information today, that you've learned something new, whether it's what the acronym SAFE means, or maybe a better understanding of some of the current challenges and efforts that are underway in different regions. So I thank you, our speakers and our listeners today, for your dedication and hard work towards the elimination of trachoma. As we heard in our opening remarks, the last 50 meters is sometimes the most difficult and costly. And there's a question that we didn't get to on never treatment. And I know that never treated or the zero dose are some of the hardest to reach. And we talked about Amazonian, rainforests and difficult locations in Ethiopia. So we need to keep working to make sure that that no one faces blindness due to trachoma in the future. And that is our goal. So thank you to you all. And a reminder to everyone that January 30th is World NTD Day. And thank you, Kristen, for reminding us of that in your remarks. So in the chat box, there are some ways that you can get involved here in Canada, or if you're not in Canada, ways that you can get involved globally through various webinars and social events that are happening both before the 30th and after. So with that, I'll thank our speakers once again and thank our audience for being with us, and wish you all a lovely afternoon or evening, depending on where you are. Thanks so much, everyone.
Okay. Thank you.